Well, I think the most important thing about the program here at the University of Louisville is the people that are taking care of the patients. The doctors are extremely well trained. They have years of experience in taking care of patients with a large variety of complications of pregnancy. And I think the combination of the diversity of the physicians along with their experience really makes the University of Louisville very unique in their ability to take care of the high-risk patient.
We can provide total prenatal care, which is to care for you from the beginning of your pregnancy all the way through delivery and your postpartum period. Or we can work in consultation with your primary obstetrician and gynecologist so that your relationship with that primary OBGYN remains intact.
One of the most important things that a maternal fetal medicine specialist can offer is the ability to evaluate patients who have either had problems in a prior pregnancy or have medical issues that may impact the success of their pregnancy. We work with the reproductive endocrinologists or the internal medicine physicians in order to make sure that the woman is carefully and adequately prepared for pregnancy, that their diabetes or their blood pressure is adequately controlled and optimally controlled so that we can ensure that the pregnancy progresses along and that the outcome for the baby is as best as possible.
We are especially proud of our ability to provide comprehensive first trimester screening and diagnosis of a wide variety of genetic conditions. A patient meets with a physician and she has an ultrasound performed to confirm her gestational age. At that same visit, she's offered a screening evaluation for birth defects and genetic disorders. Those who have abnormal first trimester screen results can then have early diagnosis with chorionic villus sampling. This is often known as CVS. Dr. Vernon Cook is Louisville's most experienced provider of chorionic villus sampling, with an excellent reputation for thoroughness and safety. We are also encouraging patients to come to us who are not yet pregnant, but are hoping to have a healthy pregnancy. They may have had a prior pregnancy that was complicated, or they may know that their family has a specific health disorder or genetic disorder that concerns them. Either way, pre-pregnancy counseling can make a world of difference.
The University GYN OB Foundation is proud to state that we have been accredited by the AIUM since 2003. Accreditation is a voluntary peer review process that encourages practices to meet or exceed nationally recognized standards in ultrasound. We are one of only 3 sites in Louisville, Kentucky that are accredited by the AIUM and have shown clinical excellence.
We are very pleased to inform that we have general obstetricians available 24 hours a day, 7 days a week. Between all of us, we have over 100 years of experience. In addition, we have maternal fetal medicine specialists available for consultation 24 hours a day, 7 days a week. So between all of us, we can provide total obstetrical care for our patients.
Because I was high risk, my physicians referred me to University Women's Healthcare because they do have a maternal fetal specialist, which did help me in my specific situation. I am from Campbellsville, which is close to 2 hours away, but I traveled this distance willingly because I knew I was in great hands with specialists who knew my situation.
So we're fortunate here to have a collaboration with the neonatologists who take care of the sick or premature infant. We work with them on a day-to-day basis in order to ensure that all babies are optimally cared for. Babies that we identify that have problems before birth, we often have conferences so that the planning for the delivery and the post-delivery care of the child can be adequately laid out well in advance of the event of delivery. We work closely with the pediatric surgeons and the pediatric cardiologist when necessary for other problems that babies might have in order to make sure that they optimally take care of all of the issues that the child has.
University Women's Healthcare. Redefining women's healthcare.